In this scenario, the nurse wants to confront her surgeon, Mary, for her behaviour in the operating theatre. Her behaviour upsets the nurse and it also upsets her colleagues, and they feel that they're in a situation whereby they need to do something to rectify what's going on. Mary has a tendency to throw instruments around and shout at the nurses and get angry if things aren't going well in the theatre, which has an impact on how the nurses feel. Mary, thank you for agreeing to meet with me today. I know that your time's really precious and I do appreciate having 5 minutes with you. What I'd like to talk about is what happened in theatre on Tuesday. When you started throwing your tools around and started shouting at us, we actually felt really scared and intimidated by the way that you were talking to us and behaving in the operating theatre, and speaking on behalf of myself and the other nurses, we just felt really nervous.
I didn't realise that. I didn't realise that was the effect I was having. You know how frustrated I get in theatre. I do get frustrated, and I know that we have so many waiting lists and people, and I have patients shouting at me. You know what it's like, and trying to have to cancel some of the operations we have. I sort of take it on myself, and then I get really frustrated how short-staffed we are as well. This sounds like excuses, and I want you to know that it's not my intention to make anyone feel scared or nervous. I need people to be efficient in the operating theatre, and if my behaviour is affecting that, then I have to apologise to you and your team.
I value you being open with me here and saying and telling me the impact that this has on you. And I guess the whole situation that we're in, we're all short-staffed, we're all under so much pressure, aren't we, that it's really helpful to have this conversation, I think, and I hear that this is really difficult for you too, and you've got so much pressure on your shoulders, and I think we can all forget that when we're in the operating theatre too.
Yeah, I guess the thing is, I'm somebody, I don't want to go home until, obviously, I'm like you guys, I guess, that I want to get everything done and make sure everybody's satisfied. And to be quite honest, I just feel that I'm a little bit on burnout at the moment. So I think I'm running on adrenaline in that theatre between you and me. And that's why I turn into a bit of a monster, which is not my intention. I just want to get the job done properly. So thank you.
No, thank you for your honesty, and I'm really sorry that you feel burnt out. And if moving forwards there's anything we can do to support you, or I can do personally to support you, then please do let us know. And maybe it would be helpful for us to sit around a table and as a group and just decide how we want to work together more efficiently as a team within the operating theatre. Does that sound reasonable?
Yes, I think so. I think that would be really helpful, and obviously, try to go forward without me, getting so frustrated in there. So thank you for your understanding. I think that's helped me a lot, because I haven't been able to talk to anybody about this. So it's really, helpful. Thank you so much. Thank you.
Thank you.
I appreciate it. Well, I felt acknowledged, and I felt that Sophia had my best interest at heart and really wanted us help go forward as a team, really. I felt Sophia came across as very non-accusatory and very gentle in her manner. So everything was quite factual, and I didn't realise that my behaviour was quite so bad. And even when I did, she thanked me for being honest with her.